So welcome everyone to this information session on recent changes to the Healthcare Identifiers service and the Conformance Profile. I'm Louise Stevanovic and I'm the Product Manager for Healthcare Identifiers in the Foundation Products team. I will be chairing today and we'll be hearing from three speakers. So Monique Warren from Services Australia's Connected Care Adoption team, followed by my agency colleagues Yuki Yu from our Conformance team, and Kieran Maguire from the Foundation Products team. Just a little bit of housekeeping. So the meeting is being recorded and we will make a link to the recording available either later this week or next week. And we will also send out the meeting slides. We've muted the cameras and mics to avoid distractions and background noise. And we will be taking questions at the end. So after we've heard from the speakers, and we'll take them through the Q&A chat. So before we begin, I would like to acknowledge the traditional custodians of the lands we're meeting on, wherever you are dialing in from. I'd like to pay my respects to their elders, past and present, and acknowledge and extend that respect to any other Aboriginal and Torres Strait Islander people who may be joining us today. Here's the agenda for today. So the first part will cover changes to the HI service made in June this year. And most of these were made to support improved IHI match rates. We will then hear about the proposed changes to the conformance profile for connecting to the HI service. And we'll cover next steps, how you can give feedback on the draft requirements and also the time frame for upgrading to the new profile. And for anyone who's just joined, we will hold questions until the end rather than during the presentation. Please put your questions in the Q&A chat and we'll answer as many as we can, and you can upvote questions as well, and that will help if we have a lot to go through at the end. We'll just focus on the most important ones. So our first presenter is Monique Warren from Services Australia, which administers the HI service under an agreement with the agency. Monique is the Director of the Connected Care Adoption in the Digital Health branch. So over to you, Mon.
Thank you very much. Thank you so much for having me. I'm really excited to come to you to talk to you today about the changes that we have implemented. They do come to us from some of the work that we've done with industry, and also that ADHA has done with some of the reviews that we've done in the past and some of the audits to make the improvements. And hopefully everyone is aware of the wonderful HI roadmap that the agency has published. And you'll see some of these changes directly relate to the recommendations in that HI roadmap of things that will improve the HI match rates. So this table that you can see now summarises what we did back in June 2024. They are available in the software vendor environment for people to start testing against. Some of them, as you may know from recent communications, have been turned off, and some of those are available already in there for us to have a look at. There are also in that comms message that came out recently, there will be an updated link to the survey so that people can let us know if they think that they're going to have any concerns or issues with their current software products. So the ability to use a mobile phone number or an email address was a really big change. It's very exciting. We find that those details in a record provide a great level of uniqueness, and they're more accurate, complete and correct than some of the other address type details that we've collected in the past. We get that information through MyGov, through the MyGov Medicare Master Program, and these changes here will also improve our ability to collect that information. One of the other big findings we have for our vulnerable cohorts is default dates of birth. So for both Aboriginal and Torres Strait Islanders, and also some culturally and linguistically diverse people coming into Australia, we find that they have default dates of birth. So what we have stored within our systems doesn't always, it may correlate with their passport, but doesn't always correlate with with the facts that they know on that their date of birth was. So they'll be stored as an alternate date of birth. We've also done some improved messaging around retired IHIs so that they behave more like a deceased record. And to ensure that we can provide a unique record back, we're looking at making that IRN mandatory. Although I have to say, in most cases, we find that software products do provide that IRN, which is great. So as I mentioned, including mobile phone number and address as part of that search criteria opens the door a little wider and is more inclusive across that ID search than we have been in the past. An ID search requires a token, so a Medicare card number, a DVA file number, or an IHI. Not everyone has a DVA file number or a Medicare card, so allowing a mobile phone number in there as an ID token search allows us to be able to search for one of those 1.2 million records we have since COVID started for individuals who are non-Medicare enrolled and have an IHI and are participating in the health ecosystem, either through getting air immunisations or electronic prescriptions or any of those sorts of things. The email address has been added as an address type search, as that's was the most relevant communication type under the standard. So when doing an address search, it is name, date of birth, and the email address for the person. And gender, name, date of birth, gender, and the email address. We also, I should say, these data elements too, we have found that because of the way technology is going, so we've got Medicare, dual factor authentication, all sorts of things happening in that space, which means people are updating their government services with that mobile phone number or that email address. People don't like to be called anymore. So as with those being their preferred methods of communication, we find that they are more accurate and up to date, and they're more portable. People don't tend to change their phone numbers and their email addresses as regularly as, say, their actual addresses. So the update of additional names and dates of birth. So currently our service offers and has offered since we started in 2010, the ability for people to add alternate names through their online accounts. For people that have access to MyGov and therefore the Medicare Master Program and HI service, there's been no issue with people being able to add their own alternate names. So in my record, I have both Monique Warren and Mon Warren. But we find those vulnerable cohorts that we most want to collect that information for don't access those services. So by updating the Update IHI web service to allow healthcare professionals that have that direct relationship with those individuals to be able to provide that information on their behalf is a little bit of a game changer that we're pretty excited about. It goes again with a strong connection, I would say, to both Aboriginal and Torres Strait Islanders, especially those that live in rural and remote communities, and also our culturally and linguistically diverse cohorts that have quite often have westernized names that they use on a day-to-day basis. So the capturing of consent will be something that we consider mandatory. Whilst having an IHI is not consent-based, everyone that's enrolled in Medicare or DVA automatically receives an IHI. And then those that aren't eligible for Medicare can apply. Consent is not required to allocate an IHI. However, having healthcare professionals provide this detail to us, we have included a consent element because it is disclosing identifying information to the HI service operator. So our PIA did recommend that we implement that as part of this service offering. So this change is aiming to drive the match rates, as I said, particularly for Aboriginal and Torres Strait Islanders and for those culturally and linguistically diverse peoples, and definitely for those ones in community that don't have access to those services to maintain that information themselves. That everyone living in the metropolitan areas, often on there for MyGov, doing their tax, all of those sorts of things. They can pop in and out of there and add those details themselves. So this just allows the opportunity for some of those people that may not be digitally connected to still have that information updated in their record, or either when they're moving between communities so that their record can be found, and that some of that important health data can continue on with the person. The next one is actually something I'm really excited about. I know HR service always gets me excited, but it's important to know that this one is currently turned off. This is one of the things that we would like the software vendor industry to confirm, that there won't be any issues with their products. It was created in a way that is designed to be backwards compatible. So at the moment, when someone is retired, and that means that they're an individual consumer, healthcare recipient, they have a verified IHI, and they have a date of death recorded against their record, which has been provided through the fact of death data file from birth, deaths to marriages, or they've been notified to the HI service and they've had no activity on their record for 90 days. They fall into this bucket of the retired status. To date, we have just provided a message back to software products to say the record you're looking for has a retired status. But we actually see from the reporting on our side that either the software can't process that, or there's a disconnect between that message coming back and what we're seeing, because we see the same person searched for repeatedly with the same data. And once you get to that retired status, especially where it's been fact of death data matched, it doesn't tend to move to any other status after that. So having the ability for the retired IHI to work the same way that the deceased IHI works means that we'll be passing back the IHI, we'll be passing back that it's a verified IHI, and we'll be letting you know that the record is a retired record. That way it can update the system so that it prevents the volume of searches coming through that are the same for that person. To make sure it is backwards compatible, we've left on the message that is returned currently. So this will be in addition to that message, as we didn't want to break any of the software. When we move our services to FHIR in the future, we'll look at making that a permanent change so that it behaves in the same way across all of them. So if we would love all software vendors, jurisdictions, and all of our partners in the HR service to confirm this in the SVT, Services Australia's SVT environment, for the end of February. And if we receive any feedback about that, we'll talk to ADHA and we'll do some comms out, but we are looking to turn that on after that 28th of February timeframe. IRN mandatory in a Medicare search. This one is a little bit of a game changer too. So a few years ago, I'm not sure if you'll remember, I've been here since 2008, so seen lots of changes over the time. We used to have a single exact search only. So if you didn't have the exact details on the record, you got a no match found. In 2014, we did a large piece of work with some of our jurisdiction colleagues and some of our partners with Ampersand and some of our Aboriginal and Torres Strait Islander communities to work through what it would look like if we allowed softer matching. And as part of that, we created a set of rules that allows, when an ID search is done, for there to be some soft matching as long as there is still a single unique match found for the data that's submitted. When the IRN is not submitted, it actually inhibits the ability to move through that softer matching routine. So anyone not providing the IRN in a Medicare search, in an IHI search using the Medicare card, it means that they have to have every single element exact as stored, maybe not so exactly stored as it is on the HI service record. So where the IRN's not found, we do find that there's more no match found than in any of our other search types. So making IRN mandatory, and I have to say, good practice has shown us that a lot of software developers have already built this in and allows the IRN to be passed, but we're just making that mandatory to bring everyone up to the same standard, and that allows us to ensure that those other softer matching rules can be invoked, which in turn will help us find those IHIs for all of the other digital health programs that we're using. Again, this is in the software vendor environment, and we're asking all developers, jurisdictions and colleagues to have a look in that and confirm with us if they see that there'll be any issues, and if they could do that before the 28th of February, because then we'll make a plan on the transition around that. It's also one that we're going to make sure that we fix in the future when we move to those FHIR web services. So, just reiterating the message again, these changes are available in the software vendor environment. The original comms did say that it would be until the end of January. However, with close down and some of the timeframes we have around Christmas and New Year's, and talking to ADHA, we're going to push that timeframe out until the end of February, and then we can collate all that feedback and come back and make that plan for transition. So if anybody has an issue with not being able to access the environment in that timeframe, please also reach out to let us know that too, and we can support you with anything that's needed there. So Louise, I'm not sure if there's any questions now, or if we're going to hold questions till the end.
Questions to the end, people can put them in the Q&A, and then we can address them at the end.
Perfect.
Just make sure we have enough time for all the presenters, and some of the questions may get answered as we go. So thank you, Mon, and I love your excitement for the HR service. It's awesome.
Thank you.
So if you want to take advantage of these web changes, you will need to upgrade to a new version of the Conformance Profile. So Yuki, you, our next presenter, will cover the proposed changes to the Conformance Profile and what it means for connecting systems. Yuki is the Assistant Director in our Conformance and Assurance team. Thanks, Yuki. Over to you.
Thank you, Louise, and good afternoon, everyone. So today I will start by giving you a quick overview of the HI Service Conformance Profile, and then I will talk you through some of the key changes that we have made in the new versions, and also the review process. So as you might know, the HI Service Conformance Profile software requirements. So we define the software requirements that aim to mitigate risk, and also ensuring that the healthcare identifiers that are handled safely and securely. And all software systems that are integrated into the HI service today must conform to the HI Service Conformance Profile. And we have the first versions of the HI profile published in 2011. And as the system getting more matured, and we have also been uplifting our requirements to a different versions. And we are currently on versions 4.1 that was published in June this year. And today we were going to talk about the new upcoming version, which is version 5. The version 5 of the profile will introduce the updates of the new changes that have Mon has just mentioned earlier, that would allow you to enable mobile number search and also email address search, and also allowing software to update patient details in the HI service. In addition, we have also been looking at some of the backlog items that we have, and also make some editorial enhancement to our existing requirements to improve the clarity of the requirements. So this software, this Conformance Profile version 5 is now ready for software systems to implement this web service, and that will be a following on a review process. So what does that mean for your software? So if you are planning to implement these new web service features, you must implement these required changes of the IHI web service, and also uplifting your software to conform to this Conformance Profile version 5. You will then conduct your self-assessment, also reaching out to Services Australia for HR service notice of connection testing. And then you will also be conducting observed assessment with the agency. And after that, upon your successful pass of the conformance assessment, then you will then declare conformance to the version 5 before you get in production access. So let's look into some of the key changes that we have made in the new versions of the profile. And after these sessions, we will be inviting you all to review the proposed draft of the conformance profile. And we will also send out a summary of changes document to help you understand the key changes and for you to read in conjunction with the profile. So as Mon mentioned earlier, the Medicare card search will now require a mandatory IRN number, which is the individual reference number. And software are getting more mature over time, and we are also taking this opportunity to refine some of these search types. So currently, the Medicare and DVA number search types are optional. We are making it as a mandatory, knowing that most of the system are already doing this today, and it also gives you the highest success match. The options of using Medicare card search without IRN will become discontinued in this version. And additionally, optional search types, including using mobile numbers and email address, will be introduced to support these features. So another enhancement that we have made is the mandatory validations of the IHI. So software products are getting more mature now and will be able to retrieve the IHI. And we are expecting software will be able to conduct the IHI validations using the existing IHI number. So most of the software systems are already doing this today. Once they have been able to retrieve an IHI, we are expecting software to use the IHI to ensure that that is actually matching the demographics detail in the local record. So another one is the manual entry of the IHI. So we are changing that this is currently a recommended requirement. This will become conditional. In the past, people might not be aware of the IHI because it's always working behind the scene in the background. As the system are getting more mature and also consumers are getting more aware of the IHI number, they could find their own IHI through different channels. We have also tightened this requirement. So the software will allow, if the software allows manual entry of the patient demographics detail in the CISs in the system, we are expecting the software will be also allow manual entry of the IHI. So this is a new requirement that we have introduced in this version, and this is to really mitigating the current risk that we identified. So currently, when we conduct an IHI search, the HR service might return a demographic data, such as name, sex, or date of birth, that could be different from the local records. In some cases, software might be able to see this return data and thinking that this might be a good to use in the software without actually talking to the patients, understanding if this is actually a correct demographics detail that should be used in the local record. So we wanted to mitigate the risk here. So the proposed change is that the software will prohibit software from automatically update these local records with return data. So we also wanted to mandate this by having a warning so that the software will be able to raise a warning to the user so that the user can take actions appropriately. This is a quick snapshot of the requirements, and you'll be able to find more information in the profile. And if your software, so your software will be conformant if the software does not interrogate the demographics data in the return message. So most of the software system will be already conformant to this requirement. So the error code, as Mon mentioned earlier, there are changes to the way the HR service returned the error message. So currently it will be our HR service returning a error message 0164 when the IHI status is retired. And going forward, this message will become an informational message 2270. So in the current versions of the profile, that software are required to raise a warning or alert when the IHI status is retired. So this change would likely to impact multiple requirements on the retired status of the IHI. Your software will likely remain conformant if your software are actually looking at the IHI status in the return message. However, if your error code is actually embedded into the software, hard-coded, for example, then your software will likely to require uplifting. So another one, the key features that we have put in here is to enable software system to update patient demographics details in the HI service. So these features will allow user to add and update patients' mobile numbers, email address, additional names, and additional date of birth to the HI service. So this is a new optional use case that we have introduced in this profile. So if you plan to implement these new capabilities, then your software will need to come through and conform to these requirements in this use case, and then conduct the necessary testing, the HR knock testing, and also the conformance assessment. So let's take a look at some of the examples of the conformance proof requirements that we have in this use case. So this is a recommended requirements to conduct mobile number search. Mobile number search is not mandatory. So if you would like to implement this capability, you might choose to do so. We also have also another requirements about mobile number and email address search. So if your software is considering doing the mobile number and email address search, this requirement is suggesting that your software must also attempt to discover the IHI using Medicare card or DVA number first. If these searches using Medicare or DVA was unsuccessful, then your software might choose to discover these using mobile numbers and email address. And this is to ensure that the software will be able to discover IHI using Medicare and DVA as often as possible. Last but not least, this is another requirement to ensure that the IHI is actually valid before making changes to the HI service. So the software must validate the IHI before updating the patient's details in the HI service. These requirements will ensure that IHI is active and valid. If not, the HI service will then reject the changes to the patient's detail. So that summarizes like some of the key requirements that we have made into in the conformance profile. And we would now invite you to review the draft of the conformance profile. And we will send you a copy of this feedback template. When providing feedback, please also use the suggestions column that we have. And this would help us to understand what is actually feasible for your software. So feel free to put your ideas, suggestions to those particular requirements that you would like to comment on. Additionally, we have also included 2 questions here in the template. So we also like to understand your likelihood of adopting this new profile, whether you're likely to adopt the new search capabilities or maybe the update IHI capabilities. So that would also help us to with our planning and also the conformance assessment. So your input will be very critical to us, and that will be helping us to shape this conformance profile and also making it achievable. So next steps, we will send you the conformance profile. Also, there will be a summary of changes document, as I mentioned earlier. There will be feedback template, and also the presentation slide that also will be sent to you later this week. A recording of these today's sessions will also be published on the developer portal later this week or early next week. Please look out for an email from help@digitalhealth.gov.au and add this to your safe sender list so that it won't go to your spam folder. And please also submit your feedback using your feedback template by 24th of December. So we aim to provide the responses back to you and with the revised profile by February next year, and with the final publications around mid-2025. Last but not least, the changes that we have introduced, like including the ILN number and also the retire messages features, are now released in the SBT environment. So please complete your testing and make sure you complete the survey by 28th of 2025, 28th February 2025. Thank you for your time today. We look forward to your feedback.
Thank you, Yuki. So our last, I apologise, Kieran, you can take over the slides. My apologies. And so Kieran is our next speaker and our last speaker today. He's the Director of Foundation Products, and he'll be talking about the time frame for upgrading to the new conformance profile. So over to you, Kieran.
Thanks, Louise. I like to talk about this in 25 words or less, but unfortunately, it's not that simple. So for the majority of people who have existing conformance software that is conformant to an older version of the profile, we recommend that you take a look at the updated requirements and plan to make updates to your software at some point to bring your software up to date to them. In particular, this is important to support temporary residents that Mon mentioned, that now we have over 1 million of those that have an IHI but don't have a Medicare or DVA card. So some of these changes are really important to support that group of people. As Mon mentioned, we will be delivering a new FHIR interface to the HI service. That's currently planned for July 2026. But updating your software to take advantage of that new interface is obviously going to be a significant undertaking. So you may prefer to update your existing implementation to meet these new requirements in the short term. And we are planning another consultation in early 2025 on our overall conformance framework. And as part of that, we're going to be exploring new policies and timeframes for updating to new conformance profiles and sunsetting over older profiles. So out of that process, we may come up with some requirements to actually move to newer profiles within certain timeframes. Of course, if you wish to take advantage of any of the exciting new search and update features that Mon talked about, you will need to declare conformance to the updated profile to take advantage of those. And if you happen to be in the process of testing a product for conformance at the moment, and you want to understand the new requirements and declare conformance to them, even though we haven't published the new profile yet, you can talk to our conformance team for assistance in how to be able to do that. And naturally, once we do publish the new profile mid next year, any products going through conformance testing after that will need to conform to that new profile. So now is time for questions. And so
Kieran, and yeah, thank you very much. Thanks, Kieran, and Yuki and Mon. And if I can ask you all to come back on camera, and we will go through some of the questions that have come in. So thanks to everyone who has been putting questions in the chat. We'll go through as many of them as we can now, and if we can't get through them all, you've got your names on them, so we'll be able to get back to you if necessary. and it looks like most of them that have been coming in are for you, Mon. So, I'll start and I'll read them out just for those who are listening to the recording later. So a question from Prapula is, how will Medicare optional search types based on mobile or email address work for minors or children?
Yep, great question. So for children under 14, for children 14, so there's two, sorry, I should start again. There's two groups of children, those under 14 and those between 14 and 18. The children inherit details from their parents' records in the Medicare Master Program. So where an email address or an email address or a mobile phone number is used for those children under 14, we will see you'll be able to retrieve the records for those children. We do find some people take control of their record when they turn 14, which is great. We encourage them to do, and as per My Health Record, those minors can have more agency over their own record, and parents lose the ability to see records for children when they turn 14. The mobile phone number and the IRN, I keep saying IRN, the mobile phone number and the email address will not help for those 14 to 18-year-olds where they have taken added their own details. Though you'll need to provide the details for the minors for those records.
Thank you. Next one's also for you. So this is from Atul Kamat. Now that the service will let us search using mobile numbers and email address, which could reveal private information, what steps are you taking to handle this data securely and comply with privacy laws?
Yes. So the HR service, because it's not consent-based, is also beholden to the secrecy provisions as well, which is a little bit tighter than some of those privacy principles as well. So we do have all of our systems and services sit within those secure environments that we need to maintain to be the HR service operator. The information that we provide back to healthcare organisations will not change. So we will still disclose the IHI, the number status and the record status. So 1, 2, 3, 4, 5 verified and active. However, we will allow healthcare professionals to provide to us either of those details to ensure that they're getting a single unique result for the information that's provided. And we have had legal advice from AGS around the introduction of these new tokens.
Thank you. And a related question here is, it's also about the additional name and date of birth. As a capture of consent would need to be recorded. This is from Lynette Deval. Am I right in understanding that specific software changes in the PAS or EMR would be needed? This wouldn't happen automatically if a patient has more than one name recorded in the PAS, as a consent may not have been given. Several of our health services have expressed concern that My Health Record information does not upload if the patient is undergoing gender changes and has not gone through the full paperwork changes required by Medicare. Could this assist this cohort of patients if the alternate name can be provided by the health service?
The short answer would be it will help for My Health Record, but it wouldn't help for the Medicare process. So information within while Medicare is a trusted data source for the HR service, and the HR service provides that demographic data to My Health Record, it doesn't flow from the HR service back to Medicare. So while it will help with the documentation around documentation that's being uploaded to My Health Record and can include the new names or the alternate names, that could definitely have a benefit in that space. The HR service is looking at the criticality, I guess, of sex or gender. When we look purely at the HR service around finding a unique record for the data submitted, sex and gender don't add any uniqueness to information when there is a Medicare card number, DVA file number, or IHI number used as part of that search criteria. So we are working with our colleagues at the agency as we move to FHIR and in the current environment around what we should be looking for within sex and gender. I know some of our other programs within Services Australia have removed the requirement to collect or pass that information. So we're also taking that into consideration too. It was a longer question, so Louise, have I missed? I don't feel like I've answered that fully.
The other part of the question I noticed was, will the software need to be updated to collect the consent? So the answer is yes, it will. Yes. And the software will also need to be updated to actually send the additional information to the HR service. That's
right. So while the other changes we made were backwards compatible, for TEXIS 5, Update IHI, those that will need, your software vendor will need to build that as a new web service. So it's not backwards compatible, and they won't be able to take advantage of those changes until they've come in and built that web service and done the conformance requirement and rolled out the change. So it would be a significant amount of time before that would be operationalized at the healthcare end, although it is available in there now for software developers to assess whether that's something they want to move to now, or whether they move to that as part of their FHIR package.
Thanks, Mon. Next one's also for you. But this is from Lapp and Simpson for RACs that use default email or mobile numbers for their email address, such as for ERX tokens. How will IHI handle this?
Sorry, can you say that one again?
For RACs that use default email or mobile numbers for their email address, e.g. for ERX tokens, how will IHI handle this?
If you have default phone numbers and email addresses, they won't match with the HR service. So we're, as Yuki said, our primary goal is still to use those Medicare card numbers and DVA file numbers in the first instance. And then over time, where those default addresses are in place, as people utilise the ability to have a mobile phone number or an email address as part of that searching criteria, they may look at removing the ability to store those default addresses, or they may have them as alternate contacts where they still need to use them for token delivery for, well, they use it for electronic prescribing now, but there may be other services in the future that may have a similar model.
Thank you. So this one, Kieran, I'll hand this to you in the first instance. This is, you did address some of this. It's what are the implications of not being conformant to version 5 and just staying with version 4.1 for, let's say, 2025?
Yep. So at the moment, we don't have any firm requirement to move in a specific time frame. As I said, we are reviewing our conformance framework early next year, and out of that process may come a requirement to move to a conformance profile within a certain time frame. I don't expect that time frame is going to be short. We understand that these things take time, so we would expect that people would move within 12 to 24 months of a new profile is probably what we'll be proposing.
Thank you for that. Question from similar related questions and so on about, can we wait for FHIR and update in early 2026 and ignore the version 5 setup if we don't have plans to use it?
Yeah, well, I guess same answer. Yeah. Probably. Depends on how quickly you adopt the FHIR profile.
Thank you. So I have another one for you, Mon, from Simon Brown. Will you be issuing recommendations to vendors who have not updated their software to include the IRN in time? If so, what would that be?
Oh, perfect. I was just responding to you in the Q&A too. So we do have some reports as we monitor the submissions coming in and the responses going out. So we are able to see the software products and the organisations that use those products that don't provide an IRN. So in the same time that we're doing the self-assessment through the SVT for those that already have that functionality, we'll be targeting or approaching those developers to see if it's a software limitation or an oversight or a configurable change. And once we have the data from the self-assessment and the responses from those that we know are routinely not submitting IRNs, we'll bring that all together and we'll work with Kieran's team on either a transition strategy for the short term or whether we would assess that and approach that through the FIRE changes.
Thank you. And the next question is also related to the Medicare IRN. So the current SVT, this is from John Jeffrey, the current SVT requires a Medicare IRN, but if the IRN is incorrect for an individual, the search still returns a matching record. Can we rely on this functionality? For example, if we don't have the IRN recorded for a patient, is it acceptable to simply pass a 1 for the IRN as part of a Medicare IHI search?
So that field does accept a 1 to 9. There can be up to 9 people on a Medicare card. It will have the same, it will mean that it's a compliance search under the new proposal to make that IRN mandatory, but it means that your software product won't have the benefits of that softer matching. So once the IRN, if the IRN is either not supplied or defaulted to an incorrect number, or maybe every now and then it might be correct, but defaulted to a number, it means that some of the other rules that we have in there to help in returning a record, they won't be invoked. And therefore, every other single data element that you provide will need to be an exact match for you to receive that IHI back. By including the correct IRN, it means that you have some flexibility in some of the other data fields. Where you supply the name exactly as it appears on the Medicare card, the Medicare card number and the IRN, it means that really the only variables would be in that sex or that date of birth at the moment. So they're just things to consider when looking at what you would do short term or what you would do over time.
I actually think that would be a really risky move anyway. If you've got 2 people with very similar names on the same card and you start passing 1 as the default.
If you had twins.
You could end up getting the wrong IHI. So I think that would be an extremely bad idea.
That was different was, yeah.
Yep.
Yeah.
I've got a question for you, Ki, about the conformance testing. And the question is from Gavin, how is it going to be carried out? Will it be a full retest of every use case or just a delta on the changes required?
Yeah, so I assume this question is about talking to uplift to the versions 5. So if that is the case, there will be so we're looking into a delta test in terms of the test use cases that you are already conforming to. So in the Conformance Profile 5, on some of the use cases, they might have a new additional mandatory and also conditional requirements. So you have to do those mandatory and conditional requirements if the condition has met. So there might also be a set of questions testing that the assessment team might be looking into as well. So as part of this work, we are going to develop a new version of the conformance test spec. So more detail will come later on, and that will be also provided through our developer portal channel.
Thanks for that, Yuki. Mon, the next one is for you from Lachlan. How do we go about shared DVA numbers for spouses and IHI links? Sometimes dispensing software has an issue with multiple patients having the same DVA number.
Yes, so that is, some people think DVA file numbers are specific to a person, but depending on the eligibility of the veteran, the family can be included within that eligibility type. Because the existing SOAP services don't allow an IRN to be submitted when we're doing the DVA file number, that one will not be part of this change. So the changes that we made to ensure that they were backwards compatible with the existing WSDL means that we didn't introduce any new data elements into the other search or token types. Would love to have some advice or some feedback, as I mentioned in the response. But if you think this is something that we can help industry with as we build those new FIRE web services, to be able to help manage those records where they are associated with multiple people. That's definitely something that we can look at. We don't necessarily have to do a 100% like for like as we move into that fire space. So would be happy to chat with that one offline. But some of the search updates that we did just for that June 2024 release were really targeted to ensure that developers didn't have to come back in and do full testing again to develop against those web services.
Thanks, Mon. Question about fire. Will fire be integrated with HIPS?
I'm not sure if Simon's on the call, but gosh, I hope so.
That's something then that we'll take on notice and get back to you on that one. Let me just go through to make sure I've captured everyone. I see Ian does have his hand up. I'm just trying to go through the questions in the chat first. And I know, Ian, you did have a question, so I will allow time for that. Another, just on the fire interface, is it going to replace the existing HI service or will it coexist with it?
There will be a time frame for transition. We are looking at being part of that interoperable ecosystem. So over time, we will decommission the old SOAP web services. They are restrictive in the format that they are. And the WSDL packs. So looking at moving as hopefully all of industry will be into that fire standard, which means we can be a little bit more responsive, a little bit more light touch, and hopefully easier for the software industry to integrate with and manage. It's pretty exciting. It's 14 years since we've really made some changes, so we are welcoming that as an opportunity to transition to a better technology, but also take some of those lessons learned. When we built the services that are there now, we built them before My Health Record, so most of them were built in 2009 in readiness to be turned on in 2010 when we didn't know how industry was going to really use them. But now that we have a lot more data on that and a lot more understanding, and also some exciting direction from both the Australian Digital Health Agency and Department of Health on where we want to go with that whole connected care economy, we want to make sure that we are moving with the times. So there will be a time frame for transitioning, and then we will definitely decommission the old web services.
Thank you for that. There is a question from Andy Bond. Why is an email address classified as an address rather than an identifier like the mobile number, which doesn't align to things to using things like PayID?
That was really because of the way that the WSDL was designed when it was first built back in 2010, and how the email address is structured within the WSDL. It wouldn't have been able to be a backwards compatible change had we made the email address an ID token. So it was really just a technical limitation.
All right. Let me just see if I've got most of them. I don't think we'll necessarily get across to all of them, but as I said, we will go back and answer any that are necessary. Ian, but I know you had your hand up before. You put it down. You did have a couple of questions in the chat. Concerns on soft matching and knowing the new list of allowed searches at the HI service. I'm not quite sure. We can enable your mic and let you come on and just expand a little bit on that one. No? All right. If you do want to do that, please do put your hand up. So Angus Miller, how or where do we provide official responses regarding these changes? So that was covered by Yuki. There will be a feedback form that will be sent out to everyone along with the conformance profile showing the draft changes for version 5. And we'll have instructions there about where you submit the changes. Yuki, do you want to add anything to that?
I think you covered it all, Louise. So we will have a formal email sending out this week and outlining the details of it. You will also get supporting documents around that also.
Thank you for that. There is a question from Kieran Mata. What additional support will we be getting for all these additional changes, both monetary and development resources? A lot of the work to be compliant is very resource heavy for software vendors. And are there like to be more changes to the HI service coming? I'm not sure who would like to respond to that question. There are more changes to the HI service coming, as Monique mentioned. In terms of additional support, Kieran, is that something you'd like to answer?
Sure. When you go through the actual profile when we send it out, the number of mandatory changes to existing requirements that will impact existing software is quite minimal. And as I said, there will be a significant window in which you'll be able to schedule those changes. So on that basis, there's no plans for any additional support. And because these, and a lot of software will already be conformant to the new requirements anyway. Yeah.
Thank you for that. I'm just going through, there was, let me just see if we've got any others. So, I think we have covered most of them. There was a question about the timeframes regarding the breaking change around the mandatory IRN requirement. Timing seems poor given the upload by default enforcement by pathology and radiology uploading. But I think Moni mentioned as part of that feedback can be given as part of the survey response. Is that right? That's coming out from Services Australia?
That's correct. So we have the self-assessment timeframe. We also have the ability for people to reach out at any time. There's no decision currently on when that mandatory IRN will be switched on. And I think we will wait till we have data back from industry before we make a decision on when that would be permanently configured in production as well. So we don't want to break the system. We want to make sure that people have their health information that they need in their My Health records, or that they can get their electronic prescriptions. But we would also love it if the software vendor industry would support us in making that IRN mandatory, so that they can access some of the other benefits around that softer matching. Just to ensure that we're getting the best match rates possible.
Thank you for that. We do only have 1 minute left. I am mindful that there are a few questions that haven't yet been answered. As I mentioned, I will go through them all, and we will respond directly to people if we can, or provide a consolidated response out if appropriate. So we will, I think, finish up here. As Yuki mentioned, we'll be sending out the slides, the draft changes, the conformance profile, the summary and the feedback form. That'll either be later today or tomorrow, and I expect to have the recording out by next week. So that's all for today. Thank you everyone for attending. Thank you again to all the speakers, and thank you to those who engaged through the chat. And we look forward to your feedback over the next few weeks. So enjoy the rest of your afternoon, everyone.